So you may be wondering who should be thinking about a preventive approach to cardiovascular disease. Certainly anybody who's already had a heart attack, a stent, or bypass surgery should be thinking about it, because cardiovascular disease is not cured by getting a stent. It's not cured by getting a bypass operation done. The bypass operation is very aptly named. It bypasses the blockage. That does not mean you're not going to develop more blockages. And in my experience, most patients who have already had a stent or have had bypass surgery have multiple other areas of milder disease. And that milder disease is the type of blockage that can progress to causing another event. So in order to prevent another event, we need to take a more active, a preventive approach, a bail-denine approach to your disease. Who else might be a candidate? I cannot tell you how many times in my 30 years of practice I've seen somebody come into the office complaining of chest discomfort, whose father had a heart attack and died at age 50, and they're 54, and now they're having trouble. So anybody who's got a family history of premature coronary disease certainly needs to be looking into a preventive approach much earlier in their life. People with genetic predisposition to atherosclerosis need to be getting a preventive approach. And so the easiest way for someone to get into a preventive approach might be to just call the office and get an appointment to get a CIMT done, to get that carotid scan done, looking at the arterial wall to see if there's evidence of atherosclerosis. Another approach would be getting your genetics done to see if you have genetics that are going to predispose you to atherosclerosis at an early age, or genetics that are going to tell us that you need to be on a special diet, not the standard American Heart Association moderate fat reduced diet. If you've had a stroke or a mini stroke, you certainly should be thinking about a preventive approach to keep you from having another stroke. So one of our sayings here at the office is stop guessing and start testing. So if you enjoyed the video and you're concerned about your cardiovascular health, you can certainly call the office and ask to be scheduled for a CIMT test. It's only $250. It will certainly give you peace of mind to know if you have disease or not have disease. And that includes a 20 or 30-minute consultation with me following the CIMT report that we get back to go over the results and talk about any future plans for treating your cardiovascular problems.